Good morning. My name is Agnieszka Suzinska. I'm a veterinarian. I mainly treat nephrological patients on a daily basis. My patients can be divided into two groups. The first group consists of stable patients with chronic kidney disease. The second group consists of patients in critical condition, having acute kidney damage, in whom we fight for their lives. In both these groups, blood pressure monitoring is extremely important. One of the methods we use to assess blood pressure is non-invasive blood pressure measurement using the Doppler method. A Doppler device consists of the Doppler with on-off and volume control buttons. The head is connected to the Doppler, and we listen to the heart rate of the examined limb. Another element is the manometer, which has a scale that indicates the value of arterial pressure, and a pistol trigger, which makes it possible to operate the manometer with one hand. Another element is the headphones and a set of cuffs of different sizes. In order to obtain reliable blood pressure results, it's necessary to choose the right cuff size. In order to choose the right cuff size, we put its narrower side to the patient's limb. It should cover from 30 to 40% of the limb circumference. In order to prevent the cuff from being ripped open during the blood pressure measurement, it's worth it to secure it with a Band-Aid. The pressure measurement is based on listening to the heart rate of the limb, which we stop the flow. The instrument used to find the heart rate is the head. The moment we pump the cuff with the manometer, the vessel is clamped. We slowly release the air from the cuffs and listen when we hear the heart rate. At the same time, we watch the manometer's indicator and observe at what value is the heart rate audible. This is quite accurate. I've measured this bitch's systolic pressure here at 122 to 124, which is very nice despite the stress. At the pelvic limb, the pressure is measured at the metatarsal or dorsal artery of the foot. I personally prefer the metatarsal artery. We should take a couple of such measurements to make them credible. Up to 7 measurements are recommended for cats. For me, 3 measurements are a minimum, because sometimes a cat moves, is under stress. Often the animal doesn't like having its limbs touched, because it is associated with different types of procedures, or drawing blood. Therefore, the pressure is initially higher, but with the next measurement, when the animal is more relaxed, we see that the pressure drops. In our practice, we generally assume that pressure up to 150 is the correct pressure. If it rises above 150, this is cause for concern. To measure it more often. If we have any associated illnesses, then we should introduce appropriate treatment. And we move on to the biggest and most difficult challenge: measuring pressure in giant dogs. Sometimes it's not easy to find the artery, exactly like in other species. So it is with dogs and cats. Here's where we put the head and look for the metacarpal artery. We put the cuff on above, of course. We can, of course, take measurements also on the pelvic limbs, on the dorsal artery of the foot. The cuff, of course, should be placed above or on the metatarsal arteries of the foot. Then we prepare a place here, directly above the pad, where there is this pit. It is also possible on the tail, but in the case of giant dogs, it is technically very difficult. So I advise the front chest or pelvic limb. The principle of cuff selection is identical. This will be perfect. I think it's about 35%. We put the cuff over the ankle joint. I also prepared myself a Band-Aid. See, the cuff is not very tight. I'm preparing myself the Doppler. I've got the gel prepared. I'm connecting the headphones. Before I turn on the Doppler, I'm preparing myself a place to look for the vessel. I'm putting the gel on this place. I rub it between the hair. If I have big problems, like I said, I can just shave this place. I also like to put a drop of gel on the head. An animal whose pressure we measure very often are cats. This is largely due to the prevalence of kidney disease in cats. We know that a very high percentage of older cats suffer from chronic kidney disease. But in our practice, we have animals of all ages. Blood pressure measurement is a component of the clinical examination, which we perform on every patient who arrives at our clinic for consultation or treatment. If an animal has not had arterial hypertension 6 months earlier, it does not mean that as the disease develops, the hypertension will not appear. Sometimes it also happens that hypertension is the cause of chronic kidney disease, or even the cause of aggravation of the chronic condition, so it should be monitored. Studies carried out in Canada have shown that on average in cats under stress, the pressure increases by 20 millimeters mercury. That's why we take this value of 150 as a limit, because if it's up to 130 to 120, we consider it to be stress, and 150 is the upper limit. I'm going to need help because this cat's going to run away. I start, like with a dog, by choosing a cuff. I prepare a spot to measure by moistening it with ultrasound gel. Since applying the gel to the head is not very pleasant, and we hear unpleasant noises, I suggest you turn on the apparatus only after you have applied the gel to the tail. After connecting the headphones, we can hear the pulse very nicely, but for some cats it must be an extremely unpleasant sound, so we can't always do that. We start pumping. 120. And that's it.